Introduce Erin Smith, who will provide us an update on maternal and neonatal levels of care. Erin Smith is a program manager for the Georgia Department of Public Health Maternal and Neonatal Designation Program. She is a registered nurse with more than 30 years of experience in maternal health. 5 years ago, Erin joined the Georgia Obstetrics and Gynecology Society as an abstractor for the Maternal Mortality Review Committee. And this is where she developed a passion to improve care for all mothers and newborns in the state. In July of 2021, Erin joined Georgia DPH to build strong relationships with hospitals and fully implement the Maternal and Neonatal Designation Program. In her spare time, Erin enjoys spending time with her husband and 3 adult children, traveling, dining out, and cheering on the Georgia Bulldogs. Welcome, Erin.
I love it. Thank you. Okay.
This is forward, this is back, and this is a pointer.
A pointer.
Do you
Okay.
want-
I got
mic
that.
up
Yep.
there.
Hi. Good morning. Last but not least, so like that was mentioned, I'm here just to give a brief overview of the Level of Cares program. I'm Erin Smith, and I'm the manager of the program that started almost 3 years ago, and I do the maternal and neonatal levels of care. When I first started, we quickly joined with the Joint Commission and the American Academy of Pediatrics to help us with these surveys because we couldn't do it on our own. I mean, we have 70 hospitals in the whole state, and we needed their help. And so we adopted their standards, which was great. And so it was very, very helpful for us as a Department of Public Health to move forward with the program. I just want to give just a teeny bit of history that in 2015, ACOG published with the Society of Maternal Fetal Medicine their joint consensus document on levels of maternal care. And in 2019, it was updated. And then in 2021, they did our own national pilot just to make sure that the hospitals, had the guidelines and they were workable and appropriate. So now those are all throughout the whole country. Those are out there. So you may be thinking, why maternal levels of care or neonatal? And well, one reason is obviously to reduce our maternal morbidity and mortality because we know those numbers are rising. And that and it's also that recommended evidence-based strategies to try to improve that care. Eventually, we want all hospitals to become verified for the OB and neonatal levels of care and standards. So on this slide, you can see how it's divided out. We have basic care level 1, level 2 is specialty care, level 3 subspecialty care, and then level 4 is our regional perinatal health care centers. On the neonatal side, we verify level 2, special care nursery, level 3 and 4. Right now, there's not any survey out there for level 1, but American Academy of Pediatrics is working on that. Oh, my slides, sorry, I might have done that. So on this slide, what's nice about the program is you'll see that the Georgia Department of Public Health actually gives funding for this. So take a look at level 1 here. Hospital responsibility is $0. So last summer, DPH decided that for all level of care 1 hospitals, we recovered the whole entire survey and the 3-year fee. We were finding why they weren't interested in doing it was a lot of it was about money. They just didn't have the funding. So we found it in our budget to actually cover the whole fee, which has been it's been great. So yes, it's free from the government. It's giving these hospitals money. And then you can see here, level 2, we pay, the Department of Public Health will pay every level's survey fee, and then the first year annual fee. And that's pretty important to know because if you turn in an application in the middle of a year, that's considered your first year. And so that's a prorated fee. But we at the government, DPH, want to give as much money as we can. So as soon as you turn in your application, you get a bill from the Joint Commission. And then come January is when they send out all their bills. We take care of the next full year. And so it's really, the hospital responsibility is $6,000, level 3 is 10, and level 4 is $12,000, and that's over the whole 3 years. Okay. Neonatal does it a little bit different, but we still pay just close to half of the cost for 3 year, for the survey and the 3 years. So some of the common questions that I get is, how do we know what level of care we are? So Georgia gave the number, the level of care based on the CON, the Certificate of Need throughout the state. And so that was given many, many years ago. And that's how you know what level you are. And it's actually kind of based on the beds. And it's through the Department of Community Health. So if you don't know what your level is, find me after this, and I'd be happy to help you out with that, or you can shoot me an email. This is probably one of the most common questions. Do we have to be a Joint Commission accredited hospital to become verified? And the answer is no. Okay? We will work with you all, we being me and the Joint Commission, set up an account for your facility. And because it's really just a verification, not a whole accreditation. So we're there to verify policies, procedures, staffing, and everything. And the last one, is this a recommendation or a requirement? Which I would love for it to be a requirement. The only state in the United States that makes it a requirement is Texas. But, I mean, we feel like it's very important. It is really, really important. So we want our numbers to go down in the state. So we can't make it a requirement, but it is highly recommended to go through the program. So I just did, this is for the maternal levels of care, just a little roadmap. The neonatal isn't much different, but the first thing you want to do is inquire. So you want to start the process, reach out to me. I'm the only one-man show, and you probably, all of you have either met me or received numerous emails from me, I'm sure. But start the process, and just recently I put together, I call it a handbook, and it has a sample gap analysis in it. It has suggestions from people who've been through the program, step-by-step guide. This is what you need to do first before you turn in the application afterwards. So it's been fun to put it together, and it seems to be getting some good feedback from the hospitals, how helpful it was. Then this Brian Johnson, he's at the Joint Commission, and he's the one I work very closely with. He will start you with the application process and walks you through it. He will help you one time if that's all you need, 10 times. That's his job, is to help you all fill out the application. So he's very helpful. Then you start to submit the application next, once it's all done, and you give a ready date. This is when we're ready. You give 5 dates that are not, you don't want us to come. The thing that I want to tell you about this is, you know when we're coming. That's another thing that's different, is I will be in touch, they will be in touch. This is a day we're coming. Is this good with you all? And so it's not a surprise visit, which we all know what the surprise visits are like. And so we try to alleviate the nerves a little bit. Okay, so then you go over here to the fifth step here. They process application. It can take 3 days to 2 weeks to do that. You'll get assigned an account executive, and they will give a phone call and kind of go over everything, look at everything you've submitted. Do you have everything there? And then on to the next step, which is the on-site survey. And this is where myself and a surveyor from the Joint Commission will visit the hospital. Again, we tell you when we're coming. And I attend every survey, which is actually very helpful, and for me to learn about it. But also, if you get to the point of the survey where there's any findings, I will work with, it doesn't mean you're not going to get designated. It just means we have 60 days. Let's work out what the findings were. Let's work on them. I've had people reach out to their RPC, like level ones. If they had some findings, they contacted the people at their RPC, which is great to lean on them for help. So, and then I can help with you. So we're going to do everything we can to get you where you need to be for the level of care that you give. After that, and that's done in the 60 days, it's time to celebrate. I send a report to our state commissioner, and she will then publish an official letter designating you at what level of care you are. So speaking of celebrating, here are the hospitals so far that have gone through the process. Coffee Regional, St. Francis Hospital, Emory. You can see they're all over all 4 levels. Crisp Regional, Colquitt Regional, John D. Archibald, Upson Regional, Phoebe Putney, did both maternal and neonatal, Northside Cherokee, Wellstar Cobb, and then the Children's Healthcare of Atlanta at Eggleston, Northside Hospital Atlanta, Wellstar MCG Health Augusta, and at the time I made these slides, they weren't completely done, but Grady Memorial Hospital is now a level 4 too. So yay, kudos to all these hospitals though. I mean, I'm so proud of them taking the step. I mean, it's been great. And then I've had people from other hospitals talk to folks at hospitals that are inquiring about it. And so everybody's out there to help. And it's really touched me that people are like, sure, I'll talk to them, schedule a call. We even have other states that will call us to see how we're doing it. And I've had folks from other hospitals here in Georgia that will set up a call with other people from the states, Massachusetts, New Jersey, all over, and just talk about their experience. So here's my information. And if you haven't heard from me already, you probably will after this. And yeah, so anybody have any questions? Do you need them?